Season's greetings from KHTS.
Time is 4:19. You're listening to your hometown station, KHTS. I am Aaron Delatorre, joined in studio by neuroscientist or neurosurgeon, Dr. Yashar? I'm sorry.
It's hard to pronounce.
I'm blanking right now.
Parham Yashar.
Parham Yashar. Yeah. And you're affiliated with the California Neurological Institute, who is affiliated with Henry Mayo Valencia.
Correct.
Now, I've always contended that the main thing preventing me from being a neurosurgeon, not just any surgeon, but a neurosurgeon, I have extremely shaky hands. I hold my hand out and they just shake. Do you have really steady hands? Do you have?
It's really helpful to have steady hands, but it's not mandatory. In fact, surgeons, I think I can speak for a lot of surgeons when I say that we rely upon a lot of different instruments or furniture, so to speak, inside the operating room in order to relax our hands. So most of what we do is not by hovering our hands in the air. We'll rest our elbows or sometimes our wrists on a certain part of the anatomy, and that will allow us to steady our hands further.
Okay, excellent. So you have like stabilizing machines and mechanisms.
Kind of. You can put it that way.
Right. Now, are you coming from Henry Mayo right now? We're not interrupting a surgery or anything right
now.
Not at all. Okay, good. Now, you're a neurosurgeon, but you're also concerned with the spine. Now, you came in. I was talking to Lori outside. I said, "Hey, what are we going to talk to the doctor about?" She said, "Well, he's a neurosurgeon, and you're going to talk about spine problems." How are these linked?
Very simply put, neurosurgery represents surgery, as it sounds, involving any neurological element. So obviously most people think of the brain as the most important neurological element, but part of your central nervous system involves the brain and the spinal cord, and what comes off of the spinal cord are the nerves. So anything spine related is in the realm of a neurosurgeon. In fact, even peripheral nerve surgery, so patients who have carpal tunnel surgery, need carpal tunnel release, that's also in the realm of a neurosurgeon.
Now, I know that back pain is chronic. What are some of the symptoms that we should look for and be on the lookout for before we consult a surgeon?
Well, back pain is estimated to affect about 90% of Americans at least one time or sometime during their lifetime. So it's a pretty common condition, a pretty common ailment, and unfortunately when it's most severe can lead to a lot of days off from work as a result of the pain. Simply put, back pain involves pain in the back itself. So as it sounds, that can be muscle related, muscle strain, any kind of aches and pains, just like pains can develop in any other part of your body, such as the knee, the hip, joint, elbow, fingertips, knuckles, you name it. Anywhere there's a joint, similarly in your spine, there are joints located throughout, and those can be susceptible to arthritis as well over time.
Now, a lot of people are concerned that if they go in for a consultation, that the surgeon will immediately recommend that surgery is the best option to taking care of that issue. But that's not always the case, is it?
You're absolutely right. In fact, the most important thing to remember is the surgeon knows and has the tools in their pocket in order to address surgical problems. But that's not the goal of a surgeon, and that's also not the goal of any physician. Our goal is to provide patients with the opportunity to get better, whatever that involves, whether it's non-surgical options, we call those conservative therapies. That involves physical therapy, chiropractic therapy, acupuncture, acupressure, core strengthening, weight loss. There's also hot and cold therapies or aquatic or hydrotherapy. And within the realm of a physical therapist are other types of therapies called cervical traction and other decompression type therapies. So beyond that, then we talk about interventional pain procedures, and obviously when all of these options don't work or don't work well enough, then we can consider surgical ones.
Right, when all else options are exhausted, then it's time for surgery, but that's last case scenario. Now we're talking to Dr. Yashar, who is a neurosurgeon based at Henry Mayo Valencia. Now, you look like a pretty young dude. You look like a pretty young dude to me. Now, how long do you have to go to school to become a neurosurgeon?
So I'll start just from after high school, 4 years of undergrad. Then I completed 4 years of medical school. I actually did a research year. So I did a research year during my med school. So it took 5 years after I graduated.
Wow.
And then residency itself is 7 years for neurosurgery. So if you add that all up, plus the research here, that's about 16 years of schooling. I joked around when I finished my residency that I had a sweet 16 party to celebrate completion of my training.
Wow, yeah, no gray hair or anything. Must not be that
I have a
challenge.
couple.
Yeah,
I have
yeah,
a couple.
Right. Excellent. Dr. Yashar, thank you so much for coming in. If you want to find out more about Dr. Yashar, you can head over to henrymayo.com. Also, he's one of the lead surgeons at California Neurological Institute. You can learn more about the treatments that they offer, schedule a consultation, or learn more about their staff at calneuro.org. Dr. Yashar, thank you so much for coming in.
Aaron, thank you so much for allowing me to come here and talk.
Yeah, no problem. Anytime. And I'll let you know if I start having any back pain. I think that's coming in like 5 years. All right, time is 4:25. Traffic coming up in 3 minutes.
Did you know that nearly